name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with small intestine, large intestine, liver, gallbladder, and pancreas ailments, starting with the letter I. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system, then I'll address issues with the skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood and circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism, and then homeopathic remedies on infections, infestations, and the immune system, then issues surrounding fertility, pregnancy, childbirth, and postnatal problems, then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what's meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as the substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let's continue with learning how homeopathic treatments can help with small intestine, large intestine, liver, gallbladder, and pancreas ailments, starting with the letter I. From the stomach, food enters the duodenum and small intestine. The food is then squeezed into the cesium through a small valve, then passes into the ascending, transverse, and descending parts of the colon, or large intestine, and finally to the rectum and anus. The total distance between the stomach and anus is about 26 feet. The whole journey takes 18 to 30 hours from the time the food leaves the stomach. The liver and pancreas empty their digestive secretions into the duodenum through a common duct, the bile duct. Bile produced by the liver emulsifies fats, and enzymes produced by the pancreas get to work on proteins, starches, fats, and sugars. The liver does many things besides aiding digestion. It stores glycogen, a compact form of glucose, and also vitamins A, B, D, E, and K. It removes toxins, for example, alcohol, from circulation. It manufactures blood proteins and blood clotting agents. It synthesizes cholesterol, which is a vital component of all cell membranes and the precursor of many hormones. It converts saturated fats to unsaturated fats when the body is obliged to use fat rather than glucose for energy. It breaks down and recycles the iron-rich oxygen-carrying pigment hemoglobin. It dismantles excess amino acids and excretes their nitrogen-containing components into the blood as urea. Urea is one of the constituents of urine. It also produces a great amount of heat because of all the chemical reactions going on inside of it. The pancreas is a gland about 6 inches long, lying beneath and underneath the stomach. It produces large amounts of sodium bicarbonate as well as digestive enzymes. Sodium bicarbonate is alkaline and therefore neutralizes the hydrochloric acid produced by the stomach. It also produces 2 important hormones, insulin and glucagon, which control sugar uptake by every cell in the body. The gallbladder has no secretory function. It merely stores and concentrates bile sent to it by the liver and empties it into the duodenum in response to a hormone that is secreted whenever fatty food leaves the stomach. The small intestine has 2 functions: to complete the food breakdown process and to absorb nutrients into the bloodstream. Although it is only 21 feet long, it has a total absorptive area of about 200 square feet. This is because its inner walls are lined with millions of finger-like projections called villi, each containing blood capillaries and tiny tributaries of the lymphatic system called lacteals. Amino acids, glucose, small flat droplets, vitamins, and minerals pass into the capillaries and larger fat droplets into the lacteals. Whatever remains unabsorbed by the small intestines, about 5% of fats, 10% of amino acids, fiber, some vitamins, bacteria, intestinal secretions, salts, water, pass into the colon where it is gradually compacted into semi-solid feces. The bacterial population of the colon manufactures vitamins K, B12, B1, and B5, and certain amino acids. These are absorbed by the walls of the colon together with salts, water, and other valuable substances. Transit time through the colon depends mainly on the amount of roughage in the diet. Too little roughage causes constipation and related ailments such as hemorrhoids and diverticulitis. Ileus. Ileus causes paralysis of the intestines, which is a serious condition because digestion depends on food being squeezed through the gut by muscular contraction. The cause may be an obstruction or a perforated peptic ulcer, or an embolism, which is a blood clot blocking a vital artery, or abdominal surgery. Trapped, half-digested food stagnates and produces gas, which distends the abdomen. Constipation, fever, and vomiting of foul-smelling fluid follow, accompanied by dull abdominal pain that gradually wears off. If ileus is suspected, even if the pain subsides, call 911 and give nothing to eat or drink. Specific remedies to be given every 5 minutes for up to 10 doses while waiting for help. If the gas in the abdomen cannot be expelled through the mouth or anus, and the abdomen is hard and swollen, with griping pains around the navel and the vomit looks like stools, use Raphanus 6C. That's Raphanus 6C. If the symptoms are accompanied by drowsiness and a heavy, stupid appearance, use Opium 6C. Irritable bowel syndrome. Irritable bowel syndrome is also known as functional or nervous diarrhea, colon or vegetative neurosis, or mucus colitis. The main symptoms are alternating constipation and diarrhea, with occasional cramping pains in the lower abdomen and sometimes pain upon defecating. Muscular contraction in the colon or ileum is uncoordinated and spasmodic, though not for any reason that can be detected by x-rays or endoscopy. The causes are as likely to be psychological, family, marital, or work problems, a cancer phobia, in fact stress in general, as dietary. However, a low-fiber diet or intolerance to wheat, corn, dairy products, citrus food, fruits, tea, coffee, apples, pear, and salads, in that order, is sometimes the culprit. Less often, spasms can be triggered by a bowel infection, bowel parasites, overgrowth of bowel flora, candidus, spinal maladjustments, or excessive use of laxative. Twice as many women are affected as men. The diagnosis is mainly made by excluding other conditions, but if the symptoms mentioned are accompanied by persistent weight loss, see a doctor within 48 hours. If there is also fever or blood in the feces, see a doctor within 12 hours. Prompt investigation is especially important in people over 50, if only to rule out cancer. Antispasmodic drugs may be prescribed and also a high-fiber diet, although bran may aggravate problems if there is an intolerance to wheat. The homeopathic approach to irritable bowel syndrome is constitutional, although the remedies that follow may be tried first. The remedies listed under abdominal pain and diarrhea in my corresponding videos would also be appropriate. Specific remedies to be given 4 times daily for up to 14 days. For great flatulence, with constipation alternating with diarrhea and pain in the upper left abdomen, with mucus in the stools and a fluttery, tense feeling in the stomach, use Argentum Nit 6C. For burning pains in the abdomen with great thirst, nausea and vomiting, and the person also has cystitis, use Cantharis 6C. For watery stools and tearing pains and nausea made worse by the smell of food, use Colchicum 6C. For griping pains that are relieved by doubling up or pressing on the abdomen and the attack is associated with a bout of anger, use Colocynth 6C. Self-help. If a particular food is suspect, eliminate it from your diet for 4 days, then reintroduce it and see if the problem recurs. If the results are inconclusive, consult a nutritionist. If the problem is due to a trapped spinal nerve, consult a physiotherapist or a chiropractor. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.